Welcome everyone to today's webinar, Best Practices for Delivering Massive Financial Impact in Revenue Cycle with AI and Automation. I am Morgan Hafner with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. We will also have a series of audience polling questions during today's webinar. When we reach each poll slide, the poll question will pop up automatically on your screen. Our speaker will give a few seconds for you to select an answer from the options on your screen and click Submit. Thank you so much in advance for your participation. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. At this time, it is now my pleasure to start today's webinar by introducing our presenter. Ross Moore is the General Manager of Olive's Revenue Cycle Practice. He has over 10 years of experience helping healthcare providers improve their revenue cycle through the implementation of automation and AI solutions, operating model redesign, and change management programs. Ross received his MBA from the University of Chicago and his undergraduate business degree from the University of Notre Dame. At this time, I am pleased to turn the floor over to Ross to begin today's presentation.
All right, thank you, Morgan. This is Ross, and thank you everybody for joining our webinar today. Just wanted to take a moment to thank the group because I know that there's a lot going on in our lives right now, personal commitments, work commitments, so the fact that you're taking this time to be with me here for the next hour, talking about automation, talking about AI, it really means a lot, so thank you for that. Today's session is going to be focused on how you can use automation and AI specifically in the revenue cycle to drive massive financial impact. As Morgan was mentioning, I'm the General Manager for Rev Cycle Solutions here at Olive. Before joining Olive, I was at Accenture Consulting, leading the healthcare provider intelligent automation offering, so helping others stand up automation capabilities. And then before that was at Huron Consulting Group, managing revenue cycle implementations. So right now I feel like there's a lot of conflicting information that's going around in the market that you may see around automation, around AI. So my goal here today is to really help kind of debunk some of those myths that you may be hearing and really give the group a very solid framework for being able to stand up and really scale your automation program so that way you are getting that huge financial impact, that large ROI at the end of the day. The information is kind of based off of my experience in implementing automation and AI both at Olive and elsewhere. So try to make it as agnostic technology and partner agnostic as possible. So as we're going through this, feel free to ask any different questions that you find interesting in the Q&A section, and then we'll leave about 10 minutes at the end of this, so that way we can answer any of those questions that you have. And if I'm not able to answer them there, we'll be able to follow up offline and get any information that you need. So here are the 4 learning points for today. The next slide is actually going to be a polling question to be able to understand from the group which of these learning points you find most interesting. That way, as I'm going through the content, I'm able to be just a little bit more dynamic and answer questions and kind of focus on those areas that you find most interesting. So the first one is going to be around how to choose the best AI and automation partner for your organization. The second learning point is really focused on how you should use that data-driven approach to make sure that you're mining and really prioritizing those best processes for automation. The third one is around creating a really robust change management program. That way you're able to, again, engage and really invigorate your staff, make them feel excited about the capabilities for automation. And then the last one is around internal requirements and what's the level of commitment that's needed from your organization, some of the roles that are required to get engaged, and how are you really getting the buy-in that's necessary to make sure that you're setting your program up for success. So with that, I'll leave about 30 seconds for the group to go ahead and submit the response that you find best, and which one is most interesting to you. Okay, I'll give it 5, 4, 3, 2, 1. We'll close this out and go to this next slide. Okay, so good to see. It looks like the majority of folks are interested in the second piece here, how to use the data-driven approach to mine and then prioritize those best processes. And then second, kind of close to or those top, the first one and the fourth as well. So I'll make sure to tailor some of this content to make sure that we have plenty of time to go through each of these, but specifically focusing on that second bullet there for that data-driven approach. So I'll quickly just touch on why is automation important. I think we know these challenges all too well, but in revenue cycle, there's a lot of turnover. It's not uncommon to have over 20% turnover in terms of the staff you have in revenue cycle, very high staffing requirements and demands as well. So automation is really designed to directly offset those constraints that you may have around staffing. Another one to focus in on is really with the reduced reimbursement as well. I mean, when we're getting into this approach for how do you mine for the best processes for automation to give you that huge ROI, it really does come down to this first piece with the staffing reduction, and then the third piece with being able to make sure that you're plugging any holes that you have in terms of revenue leakage in order to really drive the most impact to your net revenue. And then there's also can be some cash acceleration components to the value as well. Things to focus on are with the increasing complexity of workflows, the ever-changing rules that payers have in order to seek reimbursement. That's another thing that AI can really help out with, to be able to track those different requirements as they're changing kind of real time and adjust your workflows so that way you're preventing those denials on the back end. So a few stats for the group that I found interesting and just wanted to share with you. The first is around what I'd call is the promise. So 94% of healthcare executives believe that AI is going to be able to give them a competitive advantage to be able to help kind of succeed in this current environment. But the reality is that specifically with AI and using RPA for automation, robotic process automation, about 50% of projects fail. And this is a cross-industry stat. It's not specific to healthcare, but there's no reason to think that healthcare should be any different when it comes to using RPA and using automation. So the takeaway there is that, there's a high degree of failure that's taking place in terms of sustaining these programs. And what I want to equip you with today are some of the considerations, so that way you can make sure that you're not just one of these stats that are part of that 50% where that program may fail. The other piece that's a little bit interesting is that 62% of organizations, or healthcare organizations specifically, are saying that they've deployed an AI strategy, but really only 13% have actually scaled their AI and their automation beyond just a point solution. So that tells us that right now within healthcare provider in revenue cycle, there's a lot of interest, and there's a lot of organizations that are starting to go down this path. They're maybe dabbling a little bit and doing some pilots, but very few are actually taking it to the enterprise-wide scaling where you have automation occurring in all the different functions or most of the functions within revenue cycle, and then even taking that outside of revenue cycle as well. To be able to hone in on different areas in the ecosystem. So a couple things to ground us, and again, why it's important to make sure that you're selecting the right partner in order to be able to get your automation program off on the right foot. And so on that note of selecting the right partner, I put a quote in here because I thought it was interesting. Charlene Seidman is the Vice President of PFS over at Yale New Haven, and she was recently quoted in a Rev Cycle Intelligence article. It was actually just earlier this month. The article was How Artificial Intelligence is Optimizing Rev Cycle Management. And she said, make sure that you find a company who shares the same goals with you. It's difficult because many companies are saying that they have it built, but then when you are actually having a conversation with them, what they're really looking for is a partner that they can build this with. So I think that that's something that to definitely be keeping in mind and doing a lot of diligence when it comes to selecting the right partner, because this is definitely the reality of where we are right now. And it ties back to that previous slide that shows that, over 60% have deployed an AI strategy, but 13% have actually scaled it. So what you may find in the market, it's not uncommon, is as you're reaching out and you're talking with different companies, they may be saying that they've done this before, they have the experience, but it's not uncommon where perhaps there is that experience, but not necessarily in revenue cycle. Don't really have the knowledge to know what are the best processes to automate in rev cycle and how to do those automations. It may be from other industries like financial services or from the insurance side. So make sure that when you're working through this and you're investigating different partners, how much experience they really have. So when we're looking at this slide for considerations to make sure that your program is really unlocking this massive value at the end of the day, I'm not going to go through each of these questions. I'll save you that pain and answer them individually, but rather wanted to provide this framework to you all so that way, as you're thinking about your program, as you're going through, this is what I'd kind of call that automation continuum, where you start off with your platform and your partner selection, moving into scoping the right automations for your program, next getting into implementing and building those automations, then getting into maintenance, then getting into optimization. These are questions that you can kind of take behind. There's going to be a recording of this presentation, so that way you can take screenshots or do whatever you want to do to be able to save this information off, or reach out to me. I'm happy to share it with you as well. But think about these different questions, and I'll hone in on a couple of them. Most fundamentally, I'd say the first question to be thinking through is, do you build, do you buy, or do you partner to be able to create this automation capability? I'll get into a little bit more detail later on in the presentation, but at a high level, it means for build, you're basically doing it all internally. So you may lean on providers for the RPA technology or automation technology, but you're really training yourself and then scaling it on your own. The partner approach is when you're working with, typically it's a consulting company that is going to help you set up the automation capability. They may help you with standing up those initial automations, a little bit on the maintenance, and then there's kind of this warm handoff that takes place for you to be able to take that initial basis and then scale that internally. And then the third approach is what we call buying. So working with somebody, this is where Olive plays in the market, is giving AI as a service. So that way all the functions and all the requirements in terms of the build, the maintenance, the mining, that's something that that company like an Olive is helping you with. So very important in terms of your strategy, what makes the most sense for your organization. Each of them have some benefits and perhaps some drawbacks as well. Then looking at scoping, the other thing to focus on there is just who, again, going back to the partners and selecting the right partners, who is that team that's going to be dedicated to really mapping and optimizing your workflows, because you want to make sure that you are taking that data-driven approach to find the best processes and then build the automations in a way that's going to give you the most bang for your buck. There's the least amount of maintenance that's having to take place, and that your bots and those automations are getting smarter over time as well. So again, this will be kind of the lead behind for you to think about these different questions as you're in different components of your program. So another polling question for the group, we wanted to put it out there. What do you think is the typical split between the hard costs for technology and then separate from that, the service fees or the maintenance costs when you're deploying a program? So I'll open this up to the group because when you're adopting automation, there's really going to be several different, these two different types of costs, let's say, one of which is, again, the technology. It's focused on how much is it for the bot licenses, how much is it for the design studio. There's going to be some infrastructure investments that need to take place and provisioning of computers as well. So that's more on the tech side. And then the maintenance is how much does it cost in order to actually enable the technical capability. So I'll give it another 5 or 10 seconds for the group to think through what do you think is that split in total cost between technology versus maintenance? I know the answer, so I'm not going to submit. Okay, so this is interesting. It looks like most folks are guessing that 60% technology versus 40% maintenance. And there was a study that was done by Forrester recently, and that study showed that for every dollar that was spent on that RPA software and those hard technology costs, $3.41 were spent on making that automation or making that technology work. So that group that selected the last option there was right. But don't feel bad if you're in some of the other areas, because that's exactly why I put it in here. It's something that these costs can kind of sneak up on you, and it's easy to get caught up and see, oh wow, well it's only going to cost $5,000 for the license for a specific bot. I'm throwing the word bot around for those that if you're not familiar with the bot. So the bot is the robot within RPA or automation that's allowing you to actually automate a specific process. So you're basically training that bot on how to run a process, and then there's a fee that's associated with that license. So that license, it may be about $5,000 when you're looking at it on a pure technology cost, but then that's just looking at the license. There's many other costs that go into enabling it. So examples of that would be working with somebody to develop your strategy. Again, that's usually going to be a consulting company that would help you look at that strategy, figure out, does it make sense to stand up what's called a center of excellence, where you're basically creating that capability to build the bots and then scale them internally on your own. There's the cost associated with going out and finding the right processes to build, doing the business cases around them. So all these are considerations that your group should be taking in whenever you're thinking about this program and adopting AI and adopting automation. Because again, it's not just technology, but it's also the other hard costs that go into enabling that technology as well. And then the other component of the value equation, when you're thinking about, on one hand, there's the hard cost, and then on the other hand is what I call the opportunity cost. So this is still within the realm of making sure that you're selecting the right partner, but kind of tying it back to what was mentioned and kind of alluded to in the stat that only 13% of organizations have actually scaled this internally. You need to be considering not just the cost that it takes to implement, but also the value that you're going to be extracting from it. And so the opportunity cost in that sense becomes how much value are you foregoing by selecting a partner or deciding to build this capability internally in terms of that kind of trade-off that you'd be expecting. So these are meant to be kind of a representative example using a 3-year time horizon in terms of the cost versus the return that you might expect. Olive offers AI as a service, so that's why I kind of put it in this buy. One of our models is we focus on performance-based contracts to say we're going to Garrett, for a $2 billion organization for net revenue, we're going to target a $10 million return per year on a $2 million investment. Is just maybe a representative example. For that same similar type of organization, what you end up finding, and there's absolutely going to be outliers where there's going to be some partners that are able to go above and some that are going to not be able to even get to these kind of marks. But you could expect that ROI to be more in the 2 to the 3x range. And the reason for that, again, comes down to the fact that there's a lot of people that are out there that are wanting to help stand up this capability, but they may have only done this maybe 2 or 3 times, or they may have 5 customers where they're doing this. So the amount of learning that you get from working with somebody that has done this 50 times versus somebody that's done this 5 times is immense, if you're thinking about that. Part of the reason I bring this up is, let's say you're going through an RFP and you're comparing the different quotes that are being provided to you on how much is it going to cost in terms of the licensing fees, or is it going to be the service fees, and you're trying to rack and stack those against each other. I'd be a little cautious about going for the cheapest option, because in this case, the cheapest option likely means that there's some sort of an investment that group is trying to make in order to give you, in order to have you be like almost like the guinea pig or the test that they're working with you to build that capability. So don't just focus on cost as a takeaway, focus on the cost and the value, and make sure that when you're working with and you're investigating and you're doing some of the diligence behind the partner that you're working with, that you're focusing on what is the value that their customers are seeing right now, and being able to talk to those customers and get a sense of how much value is truly being returned. The last piece here is on build. That's not as common, and the reason for that is because, again, only 13% of organizations have really scaled this. So that means that there's going to be very few people that are in the market that are going to be able to be the leader of your automation program that have done this successfully somewhere else, and then now they're working with you to be able to build that capability. More often what happens if there's an organization that's doing this kind of build on their own approach is they'll bring somebody in that has experience using automation in a different industry, and then they're going to help healthcare providers stand that up. But the reason why you don't typically see as much return on that approach is because there is a lot of domain knowledge that goes into revenue cycle, and not just revenue cycle, but knowing which revenue cycle processes are going to be the best ones to automate and how to build those automations as well. So when you're bringing in kind of that external knowledge that knows how to do automation, but not automation with rev cycle, that it just makes it a little bit harder. That group's kind of up against a stronger current in order to be able to pick and mine those best processes. So a couple of those pieces just wanted to highlight for the group. Again, this is all tying back to making sure that you're selecting the right partner for your program, and really three big takeaways from that. Again, one, make sure you're looking for the partner that has very deep experience, has done this many times over with several different customers, and you can talk to those customers and be able to really hear which processes are being automated, what was the ROI that they got on the program as well. Second thing is not just looking at the cost, but also look at the quality. So what is the value you could expect? And then when you're looking at the cost, again, there's a fraction of those costs are going to go towards the technology itself. More of it's going to go towards enabling the technology. So those are the three things. Just wanted to make sure that this group kind of takes away from the section of looking for the best partner. The next section is going to be focused on what the group 50+% of the group finds most interesting, and that's how are you using a data-driven approach to really mine and prioritize the optimal processes for automation. So what you're looking at here is what I'd say the very simple boiled down 4-step approach to an automation program. The first piece is really focusing, again, on prospecting. So that's what you could think of when you hear the word mining for the right processes, that you're going out and you have the team that's doing the interviews, is working with staff to be able to understand the specifics of that process and create business cases around that process to be able to say, this is how much of the process you'd expect to automate. So it could be in authorizations, it could be eligibility. In the next slide, I'll get to more of a map to show some of the functions where you would expect to see the most value. But tying this back to a partner, you should be able to work with a partner, and they will have a good sense of which automations are likely going to provide the most bang for their buck. Like within all of, I want to say we have over 300 or so processes that could be automated, but I'd say if you were to take those within revenue cycle, there's probably a list closer to 15 to 20 that are really going to be your best bang for your buck processes that you want to make sure that you're focusing on, and then the rest may be some more organization-specific opportunities to automate. But I say this again because if you're working with a partner, make sure that partner is not going in with a blank slate. They should have a sense of what are going to be the best ones to automate, and then it's more a sense of figuring out of those, what are the best ones to your organization that are going to be the driving the most value. The second piece comes around scoping. So once you've done the business case and you said, this is how much opportunity we expect to derive In a couple of slides, I'll talk about those components, but that opportunity boils down to usually a net revenue component, and then there's going to be a labor component to it as well, or how much cost goes into that process. But once you've narrowed down what that business case is going to provide, then working with your governance group to be able to scope that. So saying, okay, here's the 10 that we've identified as potential, and then of those, we're just going to say A and B are the ones that we want to scope and move forward with. Once you move forward to the scoping, then the next phase gets into actually the detailed mapping. So being able to say, for this process, let's say it's eligibility, here are the 15 things that need to be done, and then handing it off to a build team to actually build that automation at the end of the day. So when we're thinking about this data-driven approach, that is most heavily focused on this prospecting component, but then it also will feed into your scoping decisions. This is an example map of the revenue cycle. So there's, I'm sure, some functions that are not captured in here based off of your organization, but this is meant to give the Pareto rule that at least 80% of the functions you would expect in the revenue cycle, with some color coding to show which processes are there opportunities to automate that component of the workflow end to end. Which processes would you expect to have maybe some partial automation where, let's say, your automation is able to do a component of that process, but then you're still relying on your human workforce to work the remainder of that process. And then what's an example of a process that are, at the moment, are not really good candidates for automation? So focusing on a couple of these, I'd say that the heaviest hitter and most common ones we see typically is claim status, eligibility, authorization. So I'll kind of focus on those three because they're a little bit simpler in nature. One thing I hear pretty often is, oh, claim status. I can do that in Epic, or I can do that in Cerner. It's a set up at 276, 277 EDI transaction, and boom, there you go. But it actually goes much beyond that. So when you're thinking about automation, there are, again, those for claim status, the 276, 277s, but automation allows you to go one step further, because typically what you'll find is there may be some pretty generic information you're getting back in those EDI responses for claim status. So then your staff are typically having to go look up on the portal or the website some of those free text fields and just the more rich, detailed information, and then using that to be able to make an action on that claim. So you can use automation and AI to be able to go directly to those portals, get the more robust information that doesn't come across in the standard EDI format, and then not just taking the status, but doing actioning off of that. So let's say, for example, there's an issue with the filing order. So you can use automation to actually update the filing order for the different insurances that are on that claim, and then resubmit it without anybody having to touch it whatsoever. So just an example of how, yes, there is capability with the 276, 277 for claim status, but the automation actually goes much further than that if you're using AI and automation for it. Another one is around eligibility. So there's definitely great capabilities out there with using things like RTE or real-time eligibility. You can use automation to go, again, one level beyond that to be able to go on to, like, let's say there's again, I'll use the payer portal example where you're searching for the patient, you're getting detailed information on their benefits. Instead of using that 270, 271, this kind of can supplement it to bring that benefit information back into your EMR. And then another one of the biggest issues that we see from a net revenue perspective, and again, this goes back to the data-driven approach, mining for the right processes, comes down to leakage as a result of a denial. So with eligibility, one of the common reasons for that denial is because there's an issue upstream where a staff member may have accidentally selected the wrong plan. So let's say the patient has Cigna, but there's 5 different Cigna plans within your build, and they select plan 1 versus plan 5, and that results in a denial on the back end. Your team didn't have a chance to review it in time, and so then that resulted in a write-off. You can use automation to be able to select the right plan. That way the correct plan is being selected from the very beginning, and you're not getting that denial on the back end. So Just wanted to mention that to the group as a couple of these examples for you all to consider. So continuing on, it's very important to think about the KPIs as well, because these are typical KPIs that you may be used to seeing with, let's say, a performance improvement project where maybe you're working internally to figure out where is there a gap between a best practice figure versus where your organization is performing right now. That same kind of data-driven approach is absolutely going to be relevant when you're thinking through which processes have the best capabilities for automation, is going to drive the most bang for your buck. So sticking on this example of eligibility, and ties directly to pre-service IV or insurance verification rate. Best practice is getting that up to 98% for pre-service, having that verification complete. And if you're finding that rate is lower, let's say at 90%, or maybe even in the 80s in some circumstances, that means that you're likely experiencing higher denials on the back end related to insurance and eligibility. So focusing on better processes and automating the eligibility processes up front is going to allow you to be able to drive more benefit on the back end when you're building that case, that business case, to show how much benefit you would expect to get from that automation. So that same kind of theme can be applied to other areas as well. I'll focus on, how about the last one? So the appeal submission rate as well. Being able to get to at least 75% of the denials to get those appealed. It's more common, I'd say, to see even closer to 50% for what percent of denials are able to be worked and have an appeal submitted. So if you're below that mark, then you could use automation to be able to help work some of those appeals and work your denials. So that way, again, it's not just relieving the amount of work that's required by staff, but then it's giving you this opportunity to touch claims and to work accounts that had kind of been neglected because you just didn't have the resources to be able to get to all of those different accounts. So important to consider these KPIs. There's a number of other KPIs to consider as well, but take that kind of KPI data-driven approach when you're thinking about which processes are going to be the best to automate. From more of a, I'd say, nuts and bolts perspective, the archetype or the typical characteristics of a process that's good to automate, that's going to unlock a lot of value. Think back to, again, that opportunity cost. If you're not doing this function well, is there a big downstream impact? So a good example of that is authorization. You don't have enough resources, or your team's not getting authorizations on the right procedures, then there's going to be a very costly error associated with that. Processes that are digital in nature are going to be easier to automate because the software, you can kind of think of it as needing to read information that's on a computer screen or on an image and extract that information to be able to process that or use it in some way, shape, or form. So if you're focusing on some of the handwritten processes that require handwritten information, let's say like referrals, those referrals are a little bit harder to automate. Not to say that it's impossible, but if you're looking for that low-hanging fruit, processes that are not digital in nature are not going to be the best ones to start off with. Repetition and batching, that's another good one to focus on. The higher the volume you have and this process being done, the more benefit that's going to provide at the end of the day. So you think about economies of scale. So this is that graphic I was referencing earlier. When you think about taking this data-driven approach, putting your business cases together, you could think about it, I'd say, most particularly in these first two buckets. So what's the cost associated with that process itself? Example of that, and I'd say probably the highest cost is going to be associated with the labor. So what is the cost of that resource, not just their salary, but the loaded cost of that resource when you consider benefits. You could also kind of think a little bit about this in terms of opportunities. There are a lot of turnover that's taking place, and is there a productivity impact that you should be considering? Because once you're using automation, there's not really as much of that ramp-up period. It's just you turn it on and it works, and there's going to be some maintenance that's required, but you don't have, a 90-day period where you're working through that productivity ramp-up. Could be some of those overtime or temporary staffing costs as well. Outsourcing costs. So instead of outsourcing a function to another party, instead you could think of outsourcing this to a digital worker in a sense, where you have this bot that's doing that work instead. So not necessarily replacing a cost of an internal staff member, but replacing the need to use a vendor to be able to manage a population for you. Net revenue is going to be, I'd say, typically a bigger impact than the pure cost. So if you're thinking about a $2 billion health system, if you're able to reduce write-offs by even a couple of percentage points, I mean, that has tens of millions of dollars, if not more, of impact at the end of the day. So that's why I typically suggest focusing heavily on net revenue. So that's going to be impacting your write-offs at the end of the day. There's also opportunities to be able to get better charge capture. So it could be on a charging basis as well, thinking about your top line revenue. A general rule of thumb that I like to use is typically you would expect to see kind of a 3-to-1 ratio between the value that's coming from net revenue versus the value that's coming from a labor cost reduction. But that's going to vary a little bit by organization. It's more of a general rule of thumb. For example, if you have an organization where you have very low leakage, but you have a very high cost to collect, you may expect more benefit from your labor cost relative to some of the net revenue impacts that you have at the end of the day. So you have to balance those two components with each other. So now getting into a specific example with prior authorization management, when you're thinking about prior authorizations, there's a couple of different components to the processes that I think you all know all too well. This is an example of one of the automations that we do pretty regularly. So the first step is thinking about the which processes are going to or which procedures are going to require an authorization. So when you're thinking about that, there are capabilities in Epic, for example, where there's the payer procedure mapping table that says based off this procedure and this payer, an authorization is or is not required. There's a tendency, though, to have a lot of diligence to set that table up correctly in the beginning, and then later on, those rules can get kind of stale. And I mention Epic just because we typically see more of our customers using Epic, but the same kind of logic exists regardless of the EMR that you're using. So there's the opportunity to instead go directly to the source, go directly to the payers to be able to say, for this specific procedure, is an authorization required? You can usually do that on their website. So that's kind of step one of a part of the process that can be automated where there may be a number of staff members that are focused purely on that function. Step two is getting to submitting authorizations. Those are usually a little bit more complex in nature. If they're simple authorizations where maybe all you need is the procedure code and the diagnosis code to submit that off, those are ones that you can do easily with RPA and automation. If it's a little bit more complex where, let's say that there's dynamic question sets you're having to answer in an Epicor or an AM portal, those are a little bit more challenging to do just right off the bat with automation. So there are different partners that we work with and different approaches you can take to those where it's kind of an augmented workflow, but wouldn't expect those more complex ones to be done autonomously. You may have a staff member handling those. But then on the back end, after the authorizations are submitted, then you can have a bot that's checking the statuses of those authorizations, and then once, let's say the auth is obtained, then being able to take that authorization number, plug it into the referral shell, that authorization component of the referral shell, so that way, once the claim is being submitted, that information pulls across and you're getting it paid clean. So we've seen a lot of value in this process. For example, with one organization, it's about $2 billion in net revenue. reducing write-offs by about 20%, and that equated to almost $2 million in net revenue lift on an annual basis. So again, lots of opportunity for some of these processes to truly deliver that massive financial impact. The labor impact in this instance wasn't as high. The reason for that is there was not enough staffing and not enough work for this particular institution to be able to get to everything. That's why they had a lot of write-offs in the back end. So because there was less staff that was dedicated to it on the front end, there was a lower labor impact. But that may flip for your organization. Maybe you have 75 people or 50 people that are purely dedicated to authorization. You may see less net revenue impact, but more labor impact in terms of what benefits can be provided by that automation. So I know some of the challenges in these webinars is not being able to understand more tangibly what is the automation actually doing. So trying to provide this as an example so that way you can understand it just a little bit better in a specific use case of where huge impact's been realized. Looking at the next slide here, a couple takeaways. So keep in mind that when you're using this data-driven approach that, again, not all processes are going to be created equal. Some are going to give you more value than others. That value is going to be derived from both the revenue impact as well as the cost impact. And make sure that your partner really does have a lot of experience in selecting these right processes, knowing how to build those as well. So not just knowing what I showed you and talked through in terms of the steps of like an authorization and doing the determination and doing the statusing, but knowing how do you actually accomplish that using RPA, using bots and using AI as well to make sure that there's the lowest amount of maintenance and exceptions that are going to need to be managed on the back end. And choosing the right partner is going to be important for that. So this is getting into the last section of the presentation for today. Wanted to talk more around change management and making sure that you're getting the right resources aligned to your program. That way you can make sure it's successful. So I flashed this stat earlier at the beginning of the presentation, but there's about a 50% failure rate on automation projects. And a lot of it comes down to the fact that there is not as robust change management that's taking place and not as much focus on some of the other factors you need to consider for the program. So if you're thinking about a successful change management program, that's something that you need to make sure you're doing right off the bat to be able to really engage your staff, make sure that they are feeling excited about automation and the opportunities it brings. So that way there's not fear to maybe withhold information that's going to prevent you from being able to mine for the best processes at the end of the day. So this comes a lot down to executive sponsorship, making sure that you have the right buy-in from the C-suite. I'd say CFOs are very important when we're focusing on the revenue cycle, as well as VPs of revenue cycle, to really set the direction and the tone, saying this is a strategic imperative of our organization because we need to be able to get more done with less resources. So being able to kind of set that tone up front and then making sure that you're backing that up to make your staff feel comforted to say that just because we're trying to get more lean in our operations doesn't mean there's not a home for you in the long run. So going back to one of the stats that I mentioned earlier, there's not uncommon to have over 20% attrition rate for turnover in the revenue cycle. So that means that as roles are being turned over, the capacity that's being created in a role where automation is bringing you efficiency gains allows for staff to go fill those open roles that are in different areas where maybe a little bit harder to recruit and get the right people in the door. So one example I like to put out there is in terms of denial. So let's say that you focused on a process and you've let's say remove 40% of the work that's required, and then now you've freed up a number of FTE capacity to be able to focus on something else. Denials are, I think, a great area to be able to plug some of those resources in because there never seems to be enough people to be able to work and manage those denials. So I'd say on average you see close to about 50% of denials being worked, but in industry stat and through research, there's several articles that are out there that show 90% of claims that are denied are actually recoverable. So that just inserts a natural place to be able to to shift or upskill some of your workers so that way they can focus on some more of these complex tasks as opposed to more of the mundane, repetitive, simple tasks that they're doing on a daily basis, and also gives them a little bit more variety in the work that they're doing. One of the things that you could do for reskilling those resources too is offer job fairs, offer lunch and learn, so that way staff can learn about different roles where you do have some more openings, and it's been a little bit harder to fill those as those resources are becoming more available because their function is being augmented through automation. We put a couple of questions in here for you to consider when you're building that change management program. I'm not going to talk through them all, but we'll leave these behind for you to kind of consider as you're, again, thinking about how do I create this robust change management program and change management capability. That way I can engage my staff and make sure that they're feeling more excited and more comfortable about this program that we're embarking on. Another thing is that it's important to make sure that you're getting the right internal alignment in terms of the resources and the people that are backing you and really being advocates of the program, depending on what stage you are, what I call the automation continuum. So when you're in the beginning phases with information gathering, the requirements that you have for internal alignment are going to look a little bit different than when you're at the enterprise adoption phase. So take these considerations into play when you're thinking about the program. Because, for example, when you're starting off, you want to make sure you're getting the right stakeholders engaged at that C-suite level so that way they can be advocates for the program, making sure that you get the program off on the right foot. And then when you're thinking about enterprise adoption, so taking it beyond a couple point solutions and scaling it to other departments, you want to make sure you have really good cases and stories to be able to tell, so that way you can kind of evangelize that story and share the good news with others on the results that you're seeing. It gets them excited to be able to adopt this capability as well. So this is an example of what a government structure may look like. Your initial reaction may be, holy cow, this is very busy. There's a lot of information on here. And that's intentional because you want to make sure that you do have a very robust, very thought through, pragmatic governance structure that's been developed, because there are going to be many moving pieces and there's a lot of groups that are going to be impacted at the end of the day when you're implementing this program. So it's not an effort that it's going to be something that you do just within revenue cycle and it's a fully encased bubble where there's no other stakeholders you need to engage. When you definitely need to make sure you're engaging IT on this, you need to make sure that you're engaging your executive team. And then for an enterprise adoption, there's a lot of opportunities outside of revenue cycle. So once you start off and you get the results in rev cycle, then you're able to kind of scale that. So think about these different areas and different teams that you need to be engaging with and working with as you're going through and thinking through the program. This is an example of a team structure. Who would be the roles and some of the responsibilities of the roles in order to get a program successfully implemented. So there's definitely going to need to be an executive sponsor. They would be less than 10% of their time championing the program, helping to sign off on those final business cases, prioritizing which automations are going to be the best ones. If there's any risks that you're running into or issues you're running into, that they're going to help you with that mitigation. You're going to want a fully dedicated program manager. If you want to do this and be able to extract a ton of value, this isn't something I'd recommend doing and just kind of dipping your toe in the water. Usually you're going to want to dive in and have just a fully dedicated resource that's focusing on the program and making sure that they're keeping the group moving along and on pace for your objectives. You're going to want to have teams that are focused on designing and assessing. So that middle row there with automation assessment and designers is focused on getting folks that are going to be doing the interviews, going around, creating the business cases, gathering high-level requirements for your automations. And then that next bucket below that, I group them together, but you can either have these people grouped together or separate. But we've seen a lot of success in having one group that's focused purely on build and then another group that's focused purely on maintenance. But again, that is something that could be consolidated where maybe you have people that are building and maintaining those automations that they've built. Key thing is, again, this isn't a side project. You need to have a team of people that's fully dedicated to doing this function to really be successful and deliver a huge ROI. And then keeping in mind that there are other stakeholders that are going to need to be engaged on an ad hoc basis. So these are going to be the staff members that are performing these functions on a daily basis. Likely you're going to have to include some of your compliance departments, thinking about implications for QA, and all that good stuff. So with that, key takeaways again for this section: make sure that you do have that robust change management program. You're engaging staff. You're kind of taking the concerns that they may have up front, being able to talk to them directly, helping them see kind of that path to getting upskilled and working more complex type of work, and still seeing that there is absolutely a role for the team members more long term, and keeping them engaged in that program. So the last thing, just wanted to leave the group with before going to a Q&A while it's kind of fresh in your mind, is around what topic might you find most interesting in learning about next. We like to do these webinars periodically, so this is just helpful for us to be able to make sure that as we're doing more education to the market on automation, on AI, that we can make sure that the information that's being delivered is most relevant to you all. So I'll give you a couple more seconds to answer this one before seeing some of the poll results. So is it learning how others are using automation, total cost of ownership, or more about the different delivery models? Okay. So it looks like most specifically how others are using AI and automation. So that's helpful context to have. And if there are specific examples that you have, again, feel free to put that in the Q&A. And more than happy to follow up with you to make sure any questions are getting answered, as well as if it's something where maybe you just want to talk with an organization that can help facilitate an introduction there. Okay, so we have a little less than 10 minutes now for the Q&A.
Thank you, Ross, for that fantastic presentation. Like you said, we'll now begin today's question and answer session. So audience members, please submit any questions you have by typing them into the Q&A box you see on your dashboard. We'll try to get through as many questions as we have time for. And there's been just great engagement across the board, lots of questions coming in, Ross. One audience member is wondering if you can provide an example of a quick win process versus a more complex one that took longer to deploy.
Mm-hmm. So I mentioned it a little bit earlier, but I'd say what I like to call it the big three are around claim status, authorizations, and eligibility are likely going to be the low-hanging fruit, good places to start. Building those automations are going to be more measured in the terms of weeks to maybe a month or two at the very most, relative to some of the more complex that can take a longer period of time. So if you're thinking about a more complex type of automation, I'd say those are going to have characteristics where they don't fit as nicely into the grid I was showing earlier. So one example could be any process that's going to require some machine learning. So basically analyzing historical data or trends to be able to answer a question or know which action to take. An example of that could be like predictive denials, where you're using denials information to be able to determine which claims are getting overturned, appealed, and paid, versus what are the claims that are getting paid originally without any issue at all. So it's kind of a clean claim that's being paid in full right off that first submission. So for this more complex predictive denial scenario, there is the capability to be able to use that information, use the historical data to be able to identify before a claim is submitted if that claim is going to be denied, and then take corrective action before that actually happens. So that's an example of one that's a little bit more complex. Authorization submissions is another more complex one. If you're having to use what's called natural language processing to read clinical documentation and read notes from the physicians, and then be able to answer those clinical question sets that are being asked on why this procedure is required. would be another example of a complex one.
Those are really great examples about those two different scenarios. So thank you for giving your insight there. Another audience member is curious about AI. How does AI adjust to payer and EMR updates?
Yep. So I think actually a good way to think about this one ties back to what I was just mentioning with predicted denial. So if you're setting up your automations right, then you should be using that information that you're gathering on the back end of those functions that are being performed and are being automated to be able to feed what kind of actions are taking place more upstream. So when you talk about using AI to adjust to changing payer rules, you can, let's say you're monitoring your denials, you're using something like claim status to be able to get the information and understand which claims and why claims are being denied. You can use that information to then feed it upstream to be able to inform which processes should you be focusing on, either through automation or having staff and team members dedicated to them to be able to eliminate some of the issues that you're seeing take place on the back end. And then you can set up the tables and use some of the more complex data modeling capabilities to be able to track those trends and then be able to inform, again, those areas that you should be focusing on more upstream to prevent the negative outcome.
Absolutely, that makes sense, and tracking those trends, using that information to do so. Absolutely. We just have a ton of great questions coming in, so if any audience members want to contribute on a question, please do so. Another person is curious about implementation. They're asking, how long does it usually take to implement automation?
Yeah, so I'd say that the first step is, again, going back to selecting the right partner. I usually see that taking anywhere from maybe 6 weeks up to 3 or 4 months on the longer period, just to go through some of the diligence that's required. So that's kind of the first step, is selecting the right partner. Once you get past the partner selection and you've landed on a path saying this is who I want to go with, I'd say for more simple automations, it can take anywhere from 4 to 6 weeks to get those built. And then for more complex, it could take a month for those to be developed, maybe up to 6 months for a very complex custom automation that may be required. But again, that's also going to come back to the experience of the partner that you're working with, and being able to say, how long will this take, and then talking with customers that they have used similar automations to be able to gut check and figure out, is this in line with what was actually seeing with others?
Right, depended on that partner selection and then building out the actual automation. Very interesting. Mm-hmm. And another person has a question about pilots. They're curious, do you recommend organizations start with a pilot before scaling out a program?
Yeah, I mean, I think pilots are very important to make sure that you're understanding what is the capability and exactly how does it work, how is it impacting our organization. It's funny that this one came up because it's similar to a question that was asked a couple of weeks ago with a webinar we did with MedStar. So pilot is when you're starting off with an automation and you're using that with live production data. And you're usually trying to go with one of these more simple processes. So it could be you're dipping your toe in the water in that sense, that you want to work with somebody to do a simple process, automated, that way you can see what the results are and understand how much is it really impacting your organization. That all day I think makes sense. Compare that to a proof of concept though. A proof of concept it's still being used pretty commonly, and I really don't recommend it. I don't think it's a great approach, because that's where you're basically working with somebody to say, here's a specific process I'd like to automate. Can you work with us to be able to use test data in a test environment to be able to give us confidence that this is really a process that you can automate using RPA or automation and AI? And that I don't recommend as much because, I mean, this technology has been out here for a while, and it's been proven that it works. So that just adds, you know, an artificial gate in your process and slows things down. If you really want to make sure that it's going to work, then I'd say you can get that information by talking with customers of an organization or a partner that you're looking into. That way you can get more, you know, reliability and confidence that it's going to truly work.
Those are great.
So I think we're at the top of the hour here.
Ross. We are,
yeah,
yes.
No,
Absolutely. So do you have any final thoughts to add before we wrap up today?
I just want to thank everybody again for their time. And if they have any suggestions, questions, feel free to reach out, and I'm happy to answer them.
Great. Well, I want to thank you again, Ross, for your excellent presentation, and Olive as well for sponsoring today's webinar. So please enjoy the rest of your day, and we look forward to having you join us for future webinars.
Thanks.